whereas the clinician deals with the patient inside the hospital. And normally a consultative meeting is for 5 minutes, 10 minutes. And the methodology is a case examination, you have a lab testing, diagnostic tool. Whereas in public health, our diagnostic tools are research, policy research, population research, and the different methodology of research, qualitative research. So that's our diagnosis. That's how we diagnose what is the problem in society. What are the issues which need to be modified? What policy should be in place to ensure the health and well-being of the population is ensured? So then I mentioned about the different layers of public health. International health is about the health of few countries. And this word international health came because of the international donor agencies. I hope you know about donor agencies like USAID, DFID, OSAID. So these are some donor agencies, intergovernmental donor agencies or government donor agencies. But all these three is different, no more than donor agencies. So that's another phenomenon we have to understand when we talk about health. International support for health and developing countries is almost literally overnight vanished. USAID is closed down about a couple of months ago. So actually, most of the countries that look for the resources for the health and well-being of their own society internally. So this is an important shift in the understanding about public health. And then I mentioned about global health. Global health is the health of the entire global humanity, 88 billion people. And the agency mandated to look at global health is World Health Organization. Whereas the international health is dealt with the DFID, USAID, some of the intergovernmental NGOs. So why I mentioned this is that these are the areas, if you're interested in health, public health, these are the agencies you may associate in your future. As a professional career, as also your choice of, if anybody is interested in looking at public health, these are the institutional mechanisms you have to get a job. So that's I mentioned about it. Then also I mentioned about population health. When you talk about population health, and specifically certain population, health of women, health of marginalized people, or health of the indigenous population, health of adolescents, health of children. So this particular population group is, we call it as population health. So there are different genera, different groups of public health. This also again just give an introduction about it. So when I look at critical public health, all the social systems and sociology, critical sociology, we look at society critically. And public health, major concerns in public health and critical public health is health inequity or social justice and power relationship. And you may ask about power relationship and health. Some of you may be thinking why I'm talking about power in the context of health. But we look at the power relationship between doctor and patient care, and particularly to understand maternity care, power relationship is important. Because we ask a question, what is your preferred place of delivery? Here comes to understand about the issue of power. And very hardly any women getting girls in Kerala will say government hospital. They go to private hospital. And then there is another layer of concept called respectful maternity care. And I had opportunity to do casework and in-depth interviews and studies about maternity care in Kerala. So nobody said the preferred place of delivery is a government hospital. And everybody said, they were not treated fairly in private hospital, public hospital, and shouting, abusing, and disrespectful language used. And that was a place like Kerala, and all of it consistently they said. And one of the respondents said, whoever suggested Sugaprasavam, I'll beat him next time. There is nothing called Sugaprasavam. But the wording is important, how it is described. Oh, it is Sugaprasavam, it was a boy, the way they communicate. This is actually a power relationship. There is nothing called Sugaprasavam. Actually, it's a painful process. But the language is always Sugaprasavam. That's how it's described. This is another layer of understanding what power relationship. And again, how the doctors treat the patient. The doctor is hierarchically highly powerful, and the patient is nobody, just comes there. And it begins with most of the hospital you have uniform. And you have to remove your normal being, what you are. They put on a uniform. And uniform means you are as a person a little less. A normal person, your identity comes in the way you dress. But in the hospital, your identity is removed. And removing the identity and treatment in connection, we had to question that. It may not be, or maybe, but this is some of the question we asked about. On the critical public health, ask questions about it. How much time I have?
So you can take another 45
Okay,
minutes.
maybe another 2-3 minutes, then I ask your question. And also,